All right, sounds good, Mike. As the Omicron variant becomes the dominant COVID strain in New Hampshire, many of you have had questions and have questions tonight about the pandemic.
That's right. So we asked you to send in your questions for state epidemiologist Dr. Benjamin Chan, and he joins us live now to answer your questions. Thank you for joining us.
My pleasure. Thank you.
All right, let's get right to those questions. Nick asks, with the rapid and extensive spread of the Omicron variant, do you believe we're nearing COVID herd immunity here in New Hampshire and across the country?
Great question. We've avoided using the term herd immunity because, as we've seen during this pandemic, we believe this virus is going to keep spreading and there will be other variants or other mutations which are likely able to evade a person's immune system. So, what we believe is going to happen with Omicron is we're going to see a rapid increase in infections. It's going to spread very quickly. We still need people to get vaccinated. We need people to take steps to protect themselves. And at some point, hopefully in the near future, we'll take steps to try and get back to more normal operations in society.
All right, Ruth is asking, how do you know with confidence the number of Omicron variant infections in New Hampshire? What is the number of positive tests that are sequenced to figure out a single person's variant?
Yeah, this is a great question. We sequence a minority of all the positive specimens in the state. And there's a sequence of events. And so there's usually a lag between when somebody tests positive and when we might go on to then sequence their test results and get some idea of whether or not they have a variant infection. But what we do know is that based on laboratory testing data from last week, just in the last week and a half, we've seen a very dramatic increase in the number of specimens testing positive that are likely Omicron infection based on the pattern of the positive test. So we went from about 30 to 40% of specimens at the beginning of last week that we thought maybe were Omicron, up to over 90% by the beginning of this week. So within a week's time, we had a very dramatic increase in the percentage of specimens that were positive that were due to Omicron. And so the vast majority of the infections out there right now are due to, we believe, the Omicron variant.
Barbara wants to know, after being infected with COVID, how long does it take to show up on a COVID test?
So what we call incubation period, the period of time when somebody is infected to when they might go on to either show symptoms or test positive, is on the order typically of several days. Now, a person is usually most infectious and potentially spreading infection to others within a couple of days before they develop symptoms to a few days after they develop symptoms. So because of the timeframes here, after an exposure, somebody needs to quarantine if they're not fully up to date on their vaccines. If somebody's infected, they need to isolate because they remain infectious to other people around them, potentially able to spread the virus to other people around them, particularly within those first several days after somebody's infection is identified.
All right, we have two overlapping questions right here. First, Lisa asks, how do prevention measures, such as wearing masks indoors when around people with unknown vaccination or health status, help us with our current surge? Then Becky wonders, what are your thoughts on masks to wear for optimal protection, especially those at risk, and even if you're fully vaccinated and have received the booster shot?
Yeah, masks continue to be an important prevention strategy, both to protect oneself and also to protect other people around you. Masks serve as personal protection and they serve as what we call source control, meaning they help prevent a person's respiratory droplets from spreading to other people and spreading COVID in the event that they may or may not be infected. Different masks have different efficacy, different effectiveness. We continue to recommend that people look to upgrade their face masks, certainly from a cloth face mask to something that is of higher quality, fits better, has multiple layers of fabric. So, at a minimum, we're recommending that people wear a well-fitting surgical type mask to protect themselves and protect other people. There's a lot of discussion going on right now nationally about whether, public health should start recommending higher grade masks like N95 masks or KN95 masks for people in the community. That's not a step that we're prepared to take and not a recommendation that we're making right now for people in the community. These have have their place, certainly in the medical setting. If people have access to them and want the higher protection of an N95 or a KN95 mask, then by all means, somebody can feel free to wear the better masks. But at a minimum, we're recommending that people upgrade their face masks to one that's more of a surgical face mask that fits better and has multiple layers of fabric.
All right, Dr. Chan, take a breather. We'll have more questions for you coming up after the break.